You're listening to Health Professional Radio. I'm Henry Acosta, and I'm the host for today. And with us in studio is Dr. Katherine Faull. Dr. Katherine is the Program Director of Public Health at Torrens University, Australia. She is also the Vice President of the Australian Science Communicators, South Australia chapter. Her passion in education, epidemiology, environmental health, and ecology led her to becoming one of the top heads in Torrens University, Australia. Today, we're here to discuss about the developing of the camel flu or MERS, Lassa fever, and Nipah vaccines, and the public health challenges that Australians are going to be facing this year. With all that said, thank you for coming on the show, Dr. Katherine. It's an honor to have you with us today.
Thank you. Thank you very much for having me. I'm excited to be here talking to you today.
Can you give us a little bit more background on who you are and what you do?
Sure. So as you said, I'm the Program Director for Public Health here at Torrens University, Australia, where I really enjoy supporting our students in their progression and educational journey through the public health program, including the Bachelor of Applied Public Health, the Graduate Certificate, Graduate Diploma in Public Health, and Masters of Public Health as well. I have interests in and background in epidemiology and human and disease surveillance, as well as mosquito research and a passion in biology and environmental science as well.
What inspired you into getting into this line of work?
That's a really interesting question. Probably a number of factors. Public health really is a varied and diverse field, bringing all of my passions, as I mentioned, in biology, environmental health, and humans and community development and engagement all together into the one role, as well as communication and health promotion and advocacy, which are strong interests of mine.
Can you tell us about the coming public health concerns for all over the world and Australia?
Sure. So you mentioned the development of vaccines for MERS, Lassa fever, and virus. So each of these diseases are highly contagious, and there are currently no vaccines or treatment. The Coalition for Epidemic Preparedness Innovations, or the CEPI, is a partnership between multiple public, private, philanthropic and civil organisations, including the Bill and Melinda Gates Foundation, the World Health Organization and several international governments. The CEPI recently announced a plan to fund vaccination research into these three viruses, MERS, Lassa fever and Nipah, but this decision was not based on any immediate threat of epidemic. Conversely, as a response to the West Africa Ebola epidemic in 2014 and the current Zika situation in the Americas, the epidemic potential of 37 viral species was determined, including the likelihood of emergence and public health risk. And from these 37 species, MERS, Lassa fever and Nipah virus were chosen by the CEPI for vaccine development. I guess developing vaccines for all 37 viral species we could say would be unrealistic, but keeping these viruses and others above our radar and proactively working toward vaccines may end up saving thousands of lives in the event of an outbreak. As was the case with Ebola, these viruses have been bubbling away below the radar, but we have learnt that when we don't have a vaccine, waiting for an outbreak to occur can be a little bit too late to implement these research and development processes. So keeping them above our radar and proactively working towards vaccines is a really positive move on behalf of the CEPI. Currently, urbanisation in the developed world, such as Australia, is fairly well established, but in the developing world, particularly Asia and Africa, urbanisation is creating megacities which can act as incubators for disease and can alter the epidemiology of zoonotic diseases, bringing animal hosts closer to humans and also increasing the likelihood of human-to-human transmission. So the emergence and re-emergence of diseases is therefore likely to continue. In Australia, we are likely to see the importation of such diseases through travellers landing on or returning to our shores, as we did with Zika. While these are unlikely to cause epidemics within Australia, we should still be aware and vigilant in our behaviours and responses to public health warnings, including border protection and quarantine processes and requirements. We're not in Australia, however, immune to the effects of extreme weather events such as the heat waves we're experiencing right now, particularly in Adelaide, where I am. It's quite warm, and also floods, fires and cyclones. And these extreme weather events will always be present and present an element of risk for our communities.
What can the public do with regards to staying safe from all those kinds of viruses?
Sure. Well, Australia is quite well equipped to respond to public health emergencies as a result of, for example, the extreme weather events that I just mentioned. But communication and response are key. While prevention of the cause in many cases is not possible, the impact that these may have on our populations can be reduced through clear and timely public health policy, messages and warnings, and the adherence to or appropriate response to such guidelines on an individual and community level are crucial. So warnings, messages and guidelines seek to prevent public health emergencies by reducing the risks for individuals, our community service workers, our emergency service workers, and health professionals and practitioners. So we all, as individuals, professionals and members of the community, all play a role in the communication and response. For example, here in South Australia, our fire danger season and associated fire ban season runs roughly from November to April. And this is clearly communicated to communities and visitors within high-risk areas. And it is then their responsibility or the responsibility of the individual and the community to adhere to these restrictions and associated recommendations. In the event of a fire, our country fire service teams are incredibly prepared and reactive. And again, during such occasions of evacuation or response, it is up to the individual to respond appropriately to communications and recommendations. So if we have a willingness to be open to the communications around public health messages and we adhere to those recommendations, we can help keep ourselves safe and keep our communities safe.
With regards to Torrens University Australia, what are the steps that they're taking to help public health be more aware of what's happening around the world?
Sure. Well, universities offering public health programs such as Torrens University Australia are producing scholars with the knowledge and tools for effective communication around public health at a policy level, so at community and individual levels. In addition, the research vital to developments in public health are largely conducted by university research groups such as Torrens University Australia. We have industry partners working on the ground at a domestic Australia level, as well as international partnerships that are strengthening public health initiatives and programs, and we have some exciting research on the cards as well that involve and engage our students as well as our staff and our communities.
For anyone interested in doing a program with Torrens University Australia, what are the public health programs that you guys offer?
We have both face-to-face on campus in Adelaide, and we also have a really dynamic learning environment online as well. So I encourage anybody interested in public health or health in general to jump on the Torrens website and seek out some further information, or they can give me a call personally to discuss their potential educational journey here at Torrens University in health and public health.
So what's the main takeaway message that you want our audience to hear about this interview?
At Torrens University Australia, we're offering some really exciting programs across disciplines, and I'd be really keen to discuss what we can offer in the field of public health for anybody who's interested. So it's a growing field, and a field where you can learn and interact with a variety of different people across different communities and on multiple levels, from policy to promotion and advocacy and communications. So I encourage anybody interested to seek out further information.
Awesome. Well, that's all our questions for today, Dr. Katherine. It was a pleasure having you on the show.
It was a pleasure speaking with you. Thank you very much for having me.
You're welcome. And that was Dr. Katherine Faull of Torrens University Australia. And we just finished talking about the public health concerns that Australians are currently facing and are about to face. If you're listening to this, and if you want to listen to this again, you can go on www.hpr.fm, and you can find us on SoundCloud and iTunes.